Thank you. Thank you very much. This is a great day, and it's wonderful to be outside on the steps of the state capitol. I would first like to thank the hardworking members of the House and the House Health Care Committee and the Senate for making this all possible. It's without their work, we wouldn't be here today. And it was difficult work, time-consuming, and required a great deal of political and policy skill. And I think that Senator Claire Ayer and Chair of the House Health Care Committee, Mark Larson, deserve a huge round of applause from all of us. It's amazing that we're here and that we could be debating the fact that there could be something wrong passing a law that creates coverage, healthcare coverage, for all Vermonters. It should be at the very core of what we believe in as citizens. It should be not debatable. It should be a fundamental principle for all Vermonters, but for all Americans. All of the other industrialized countries get it, and thank God we here in Vermont get it too. I would say to those who say this change may bring uncertainty, well, what's it like to face the uncertainty of not having health care coverage at all, having health care coverage that doesn't really provide you with health care in the first place? That's uncertainty. Yeah. And uncertainty is figuring out, if you're an employer, how you're going to face another 20 to 30% increase in your health care premiums. How are you going to make sure that you continue to provide health care coverage for your employees? That's uncertainty. I can tell you that uncertainty that that brings, having sat in many partners meetings at the law firm that I work in, figuring out how we're going to continue to pay for health care for our employees. That's uncertainty. Yeah. And the uncertainty that exists with the payment system that we have now. I don't know if any of you have been looking at any of your health care bills recently or your insurance explanation of benefits, but I have 17 years of education and I can't make heads or tail of it. That's uncertainty. This bill is a common sense start to making sure that all Vermonters have coverage, that everybody's got skin in the game, and that we have common sense payment reform that pays per performance, not for number of visits. That's what this bill is about. I want to thank everybody here who has worked so hard to get this bill passed, and I want to thank you now for the work that we're going to have to do in the coming years. This is the beginning. This is not the end. We have hard work to do. There are definitely people who want to see this fail. We cannot let that happen. We need to work together to show the way for the entire country. We can do it. Vermont's done it in the past. We'll do it again. Thank you very much.